Hello, I'm Dr. Ryan Kazemi, an oral surgeon here in Bethesda, Maryland. In this video, I would like to describe a non-invasive technique for removal of dental implants in the aesthetic zone, which uses a unique reverse torque approach that requires no incisions and no bone cutting or removal whatsoever. So this patient came to us for evaluation of a lateral incisor crown supported by a dental implant. She had noticed a gradual grayish color change of her gum tissue, as well as chronic discomfort. She also did not like the aesthetic nature of the crown, which was longer and somewhat asymmetrical compared to the other side. In addition, there was some gum tissue deficiency. The X-ray showed a dental implant which was poorly aligned and had evidence of bone loss with exposure of the implant surface, which was primarily the reason behind the grayish color that seemed to come through the gum tissue. And the cone beam CT scan showed more accurately the orientation of the implant as well as the evidence of bone loss, approximately 4 to 5 millimeters in length. So after a multidisciplinary team consultation with a restorative dentist and an orthodontist, a treatment plan was proposed, which consisted of orthodontic treatment initially to improve her bite and the overall teeth position, followed by removal of the dental implant, and then a plan for replacement with a new dental implant once the orthodontic treatment had been completed. So the first step was to remove the crown and separate it from the underlying abutment. Now in this case, because the crown was a ceramic restoration, it was rather easy to segment it and remove it. The next step is to remove the abutment. Now she had reported that a previous dentist had attempted to remove the abutment but was faced with great difficulty and was unsuccessful. The dentist had tried drilling out the screw but could not loosen it and therefore decided to leave it in place. So during our attempt to remove the abutment, it was noted that the head of the screw had been stripped and therefore we could not engage the driver to remove it. So in these circumstances, the head of the screw must be gently drilled and removed in order to free the abutment. But it's very critical that the head of the screw is very conservatively reduced so that we can access the remainder of the screw for complete removal once the abutment is out. Now with the abutment out and with just enough screw beyond the implant platform, we can easily access and retrieve it with a fine instrument. Now this particular implant is an external hex implant which was placed about 11 years ago. The next step is to remove the implant itself. And for this, we're going to use a reverse torque technique to debond the interface between the implant and the bone and remove it atraumatically. The first step in this technique is placement of a guide pin that is rotated clockwise until it is stable and with sufficient tightness within the implant. Next, the implant removal component is placed over the guide pin and then rotated counterclockwise until its margin is fully seated and engaged with the implant platform. It's really important that we use the right size and diameter for proper engagement of the implant head. Next, a wrench is placed, and with a firm and steady reverse torque load, the implant is gently disengaged and mobilized. The implant, once it's freed, is completely removed. The site is gently curetted to remove any inflammatory tissues and then simply irrigated with saline. Now, the site of the implant removal will heal like an extraction socket. However, to promote its healing and soft tissue maturation, a platelet-rich fibrin plug was created from one vial from patient's own blood and placed into the socket. This is a great biological dressing and a promoter of the healing. Patients typically have no or minimal discomfort post-operatively, and no swelling and quite a quick recovery. This technique is effective for removal of all implant types, whether it's because of inflammation or infection, poor aesthetic results, or functional issues. It is also quite effective in implants that have been placed years ago with full integration. Feel free to watch some of our other videos on this topic on our website or our YouTube channel. Thank you.